Welcome to this lecture on aneurysmal subarachnoid hemorrhages. My name is Abigail Talavera. I am a lead clinical nurse in the neuro ICU here, and I understand that you're all ICU residency new graduate nurses. Is that correct? Right. Okay, this is a core class in your ICU residency, and I'm so excited to share this content with you. I want you all to be active learners today. I want you to collaborate with each other, participate together. I really want you to engage with this content because it's so important to the work that you are going to be doing in the neuro ICU. So with that being said, let's get started. All right, so now that we're all looking at the PowerPoint, let's read through these learning objectives that I've outlined for today. So by the end of this lecture, I want all of you to be able to state at least three risk factors for aneurysmal subarachnoid hemorrhages, to be able to state the two grading scales that are used to characterize aneurysmal subarachnoid hemorrhages, and finally, to be able to describe the signs and symptoms of an aneurysmal subarachnoid hemorrhage. So now that we've outlined what we're going to learn today, let's dive right in. So there's two categories for risk factors for aneurysmal subarachnoid hemorrhages. The first being modifiable risk factors, the second being non-modifiable risk factors. So some modifiable risk factors would be hypertension, tobacco use, a history of cocaine use, and pregnancy or parturition. Non-modifiable risk factors include an increasing in age, inherited connective tissue disorders, and that is because those inherited connective tissue disorders affect that smooth muscle wall lining of even our cerebral vessels. So over time, they can lead to an outpouching or a weakening of that blood vessel, leading to an aneurysm, which would potentially lead to a ruptured aneurysm, which would lead to an aneurysmal subarachnoid hemorrhage. And the third non-modifiable risk factor would include a familial history of cerebral aneurysms. More and more research is showing such a strong correlation between a familial history of cerebral aneurysms and ruptured aneurysms. All right, so moving on to our second learning objective, which was to be able to distinguish between the two grading scales used to characterize aneurysmal subarachnoid hemorrhages. So those two grading scales are the Fisher grading scale and the Hunt and Hess grading scale. Let's start by talking about the Fisher grading scale. This is a grading scale that has 4 levels, 1, 2, 3, 4, and it is completely preoccupied with the findings on a CT scan. That is the only thing that it measures. It's a completely objective grading scale. So grade 1 would mean that there was really no subarachnoid blood found on the CT scan. Grade 2, which is even worse, would indicate that there is diffuse or vertical layers of blood seen on the CT scan, but it's less than 1 millimeter thick. Grade 3 would be that the CT scan would show that there's a localized or vertical layers of blood on the CT scan, and it's greater than 1 millimeter in thickness. And grade 4, which is the most detrimental, is that there's intracerebral or intraventricular blood or a clot, and there's diffuse subarachnoid blood noted on the CT scan. So that's the Fisher grading scale. Now let's talk about the Hunt and Hess grading scale. So the Hunt and Hess grading scale has 5 levels, similar to the Fisher grading scale in that level 1 is the least severe and the higher levels 4 or 5 are the most severe. So the Hunt and Hess grading scale has 5 levels, and it is only concerned with the subjective assessment of the patient. Has nothing to do with what's seen on the CT scan. This is only looking at the patient and their physical assessment and neurologic assessment. So grade 1 is the patient is asymptomatic, maybe a mild headache, but really they seem normal. There's no deficits that can be found on exam. Grade 2 is that there's a cranial nerve palsy. So what does that mean? That might mean that there's a droop, kind of like you would see in Bell's palsy. And there's a moderate to severe headache, so quite different than grade 1. And additionally, there's nuchal rigidity. So when the provider would be assessing the patient's neck, it's very stiff, very painful. Grade 3 on the Hunt and Hess grading scale is that there's a mild focal deficit. So a focal deficit means that an arm is weak, a leg is weak, or one side of the body is weak. The patient's going to be more lethargic, and the patient is definitely going to be confused. Grade 4 on the Hunt and Hess grading scale, the patient is very difficult to arouse. You might need to be sternal rubbing them to get them to wake up or move their limbs. They would have moderate to severe hemiparesis, meaning one side of their body is completely flaccid. They don't have muscle strength in that side. And they would have early decerebrate rigidity. So that's a neurologic finding. Grade 5 is the patient is in a deep coma. You might be sternal rubbing them. You might only be getting reflexes. Maybe their only neurologic assessment that you can assess is that they have reactive pupils and maybe a corneal reflex. So that's the 5 grading levels of a Hunt and Hess, of the Hunt and Hess grading scale. Does anyone have any questions about either the Fisher grading scale or the Hunt and Hess grading scale before we move on to our third and final learning objective? Nope, everyone's good. Okay, all right, let's move on to our third learning objective, and then we're going to dive right into some case studies. Okay, so our third learning objective, as we saw in the PowerPoint when we got started, was to be able to identify the signs and symptoms of an aneurysmal subarachnoid hemorrhage. So not only do you need to know this to be a successful neuro-ICU clinical nurse, but also the reason I put this as a learning objective is that I really want you to take this knowledge on identifying signs and symptoms out into the community, because when an individual has an aneurysmal subarachnoid hemorrhage, they're usually out in the community and it is a medical emergency. So what are they? Can anybody, has anyone heard of what a classic sign and symptom of a subarachnoid hemorrhage is? What's the first thing that comes to your mind? Yes, worst headache of your life. That's exactly right. Thank you. So you'll have a patient say, I was shoveling my driveway, I was driving to work, I was at the grocery store, and I just got this thunderclap headache, worst headache of my life. So that is classic. And patients tend to use the same word choice. They all describe it as the worst headache of my life. So that's very key, and I want you to remember that from today. Another sign and symptom is you're going to have the neck pain and rigidity, like we talked about previously when we were talking about the Hunt and Hess grading scale. And they're going to have photophobia. The reason that subarachnoid patients have photophobia is because the blood that collects there in the subarachnoid space sits there and starts to irritate the ocular nerves. So if all of a sudden they're saying, I have the worst headache of my life and these lights are so bright, that might be indicative of an aneurysmal subarachnoid hemorrhage. And then focal neurologic deficits, if the same thing, if on assessment one limb is weak or has no movement at all, that's a sign and symptom. And the final sign and symptom is the cranial nerve palsies, like we talked about before. Maybe the facial droop, maybe an eye droop, maybe only one corner of their mouth raises if they would try to smile. All right, so those are the signs and symptoms. Does anyone have any questions before we move on to our case studies? Okay, all right, sounds good. Let's move on to our case studies. Since this is a small class, there's only 12 of you, let's just pair up into pairs, so it'll be 6 pairs total. So turn to your partner, and if you can turn your attention please to the PowerPoint. Case study number 1. Mr. Smith is a 45-year-old male with report of sudden onset of severe headache and loss of consciousness.
The CT reveals subarachnoid hemorrhage. On his neurologic exam, the findings are that he's lethargic, he's responsive to verbal stimuli, he's oriented ×1, so he's confused. He has a focal deficit. He's a 4 out of 5 strength in his right upper extremity. And he has a right central 7th, and that's indicative of a 7th cranial nerve palsy. All right, so turn to your partner and let's think about this. You can go back and review the Hunt and Hess and Fisher grade classification scales. What do you guys think is his Hunt and Hess classification grade? All right, everyone have their answer?
That's right. That's absolutely right. It's Hunt and Hess grading scale number 3. And that is because what we learned from the case study is that he definitely is lethargic, he is confused, and he has pretty significant focal and cranial nerve palsies. So that buys him a grading scale number 3. All right, let's move on to case study number 2, if there's no questions before we move on.
Case study number 2. Mrs. Jones is a patient admitted from the ED with an aneurysmal subarachnoid hemorrhage. On her CT, the radiologist read the image as having less than 1 millimeter of blood. Her physical assessment is notable for cranial nerve palsy, nuchal rigidity, and she is reporting 7 out of 10 headache. She is alert and oriented, however. What Fisher grade and what Hunt and Hess grade would you anticipate Mrs. Jones to have? Give you a few minutes to work with your partner to come up with your answer.
Hunt and Hess grade 2 and Fisher grade 2 also. Okay, so it's 2 and 2. That is absolutely correct. She has a cranial nerve palsy. She has a really bad headache, a 7 out of 10 headache. However, she's not confused. She's oriented. And then the Fisher grade is number 2, like you guys determined, because there's less than 1 millimeter of blood notable on the CT scan. So very good. Okay, any questions before we move on to case study number 3? No? Okay, let's move on.
Case study number 3. Mr. Harris arrives to the ED with a suspected aneurysmal subarachnoid hemorrhage. You know that all of these risk factors put him at risk for this event, except positive cocaine use, uncontrolled hypertension, 20-year smoking history, and a history of chronic anemia. All right, turn to your partner and collaborate on finding the right answer, and then we'll go over it as a group.
That's right, a history of chronic anemia. That's right. The other 3 we talked about as signs and symptoms of an aneurysmal subarachnoid hemorrhage. So great job picking that out. So I'd like to share with you, just as we wrap up this lecture and our group work on these case studies, I'd like to just wrap up with a video from a movie star, primarily from the 1990s, named Sharon Stone. And she gives a real-life testimony on what it's like to survive an aneurysmal subarachnoid hemorrhage. I think it's so important to actually hear it from the patient. And so let's watch this testimony from Sharon Stone.
I woke up finding out that this is what had happened, and then I had to learn to walk, hear, write, talk, remember, and everything all over again.
I want to thank you all for your time and attention today. If you have any questions as you move forward in your clinical practice, please don't hesitate to reach out to me. My email is listed on the PowerPoint, and I hope you have a great day. Thank you so much.